Hello. Good morning, sir. Hello. Hello. Good morning, sir. Sir, please unmute your mic, sir. Hello, sir. Dr. Avinash, sir.
Yes,
Welcome you, sir.
I'm there.
Welcome, sir. We'll wait for another 5 minutes, sir. The students are joining.
Okay.
Yes.
Hello. ಹಲೋ ಹಲೋ ಸರ್ ಇಲ್ಲ ಅವ್ರು ಅನ್ಮ್ಯೂಟ್ ಆಗ್ಯಾರ. ಹಲೋ ಮೇಡಮ್. ಹಲೋ ಸರ್. ಹಲೋ. ಹಲೋ. ಹಲೋ ಸರ್. ಇಲ್ಲ ನಾನು ಕೇಳ ನಾನು ಮಾತಾಡ್ತೇನೆ. ಹಲೋ ಅಂತೇಳಿ. ಹಲೋ ಸರ್ ಜೊತೆ ಮಾತಾಡ್ತೀನಿ. ಅಲ್ಲ ಅವ್ರ ಜೊತೆ ಮಾತಾಡ್ಬೇಕಾಯ್ತು. ಅವ್ರಿಗೆ ಮತ್ತೆ ಅವರು ಅವ್ರದ್ದು ಅವಿನಾಶ್ ಕವಿ. ಹಾ. ಹಲೋ. ಹಲೋ ಸರ್.
Dear students, kindly mute yourself.
ಹಲೋ. ಹಲೋ ಸರ್.
Dear students, kindly mute yourself. Hello. ये बड़ा कितनी है ना यहाँ मोड़ा कितनी है
Hello, sir. I had got a call, so I had to interrupt for some time.
Good morning, sir.
Yes, sir. Good morning.
Yeah, within a few minutes we'll just start, sir. Yeah, few more
Okay.
students they have to join.
Okay.
Madam, who joining? Start. Start.
2 minutes.
2 minutes, sir.
हाँ
Hello. Dear students, one instruction for you. Do not share the screen and don't unmute yourself. Okay, if the resource person or any of your teachers say to unmute, then only do unmute. Okay, or else just mute yourself and listen to the webinar. Okay.
Okay.
And also one more thing, in chat box, you just enter your names once again for the second session. Okay. Thank you.
Hello. Start. Good morning, dear students.
Good morning, sir.
Good morning, sir. Good morning, sir.
Good morning.
Good morning, sir.
Morning, sir.
Morning, sir.
Good morning. Myself, Dr. Vijay Kulkarni, HOD Physics. I
ಬಿಡು ಮುಗಿಲಿ ಎಲ್ಲ ಗುಡ್ ಮಾರ್ನಿಂಗ್ ಹೇಳತ್ತ ಶಿವಕುಮಾರ್
myself, Dr. Vijay Kulkarni, HOD Physics, take the opportunity to introduce our today's speaker. So today we have an eminent personality, Dr. Avinash Kavi, with us to deliver a session on awareness of COVID-19 and their SOP to be followed. Now, with his brief introduction, Sir has completed his MBBS in the year 2010 from JN Medical College, Belagavi, and he has completed his master degree in community medicine in 2014 from the same institute, JN Medical College, Belagavi. Currently, Sir is working as assistant professor in the Department of Community Medicine at JN Medical College Kelly Academy of Higher Education and Research, Belagavi. So, sir is a research officer for Women's and Children's Health Research Unit, Global Network for Women's and Children Health Research, NICHD USA. He is a member of WHO Collaborating Center for Research in Maternal and Perinatal Health Research. So he is a project coordinator for Global Networks MNH Registry A Plus trial, that is WHO Scope Study and WHO UMIBLO International Study. Sir is the executive committee member for Indian Red Cross Society and a program officer for Youth Red Cross Unit. And into his research, sir has published 23 research papers at various national and international journals. So even he has received Best Paper Presentation Awards at various conferences. Along with, sir is a associate editor for a journal called Biomedical Central Reproductive Health Journal, London. It's an international journal. With this brief introduction, herewith I am presenting Dr. Avinash Kavi. Welcome, sir. Welcome for this session, sir.
Yeah, thank you, sir. Thank
Now,
you for your kind introduction.
Yeah, now over to you, sir.
So can I share my slides?
Yes, sir. Yes, yes, sir.
ಮ್ಯಾಮ್ ಅದು ಹಾಕ್ರಿ ಇನ್ನೊಂದು ಅದ್ರ ಮೇಲೆ.
Sir, is my slide visible?
Yes, sir.
Yes,
sir.
sir,
It's
it is.
Okay. So, thank you so much for your time and having thought of this topic to be included in your orientation program. I hope these are the students who have joined engineering course now, or
Sir,
like
newly
already
joined.
they are being in this profession.
No, sir, newly joined.
Newly joined. Okay,
Yeah.
fine. So they're fresh from class 12, right?
Yes, sir.
Okay, fine. So I hope all of you were fortunately or unfortunately at home for almost around 9 to 10 months, and then subsequently you had an opportunity to give your exam, clear that exam, and finally have managed to somehow join this professional course as one of the reputed institutes, Fangadi Institute of Technology. So, however, with all these things, so new things, we are adopting to the new norm. Probably if this COVID situation would have not been there, probably I would have not been giving you this lecture, or else even if some regarding some health issues related, someone might have called me, I would have directly come to our institute to give this lecture. But adopting to this new norm in this era of everything being virtual, so even this orientation program is also being conducted virtual. For the next 20 to 30 minutes, I would like to give you a brief outlook regarding the personal and general hygiene and response and containment procedures that has to be adopted by all of us in regards of COVID-19 pandemic. So everywhere, why we call it as a pandemic? Because it has the first novel coronavirus was detected somewhere in the month of November 2019, and we have already celebrated the first birthday, November, December, and first birthday of novel coronavirus, and it has almost spread to the entire world, and the whole world is covering half of their face. Earlier, people used to cover to avoid dust. People used to cover their entire face except for the eyes. Even some of them do even today because they don't want to get tanned, and so many other things. But you can see a new norm, new fashion of wearing a mask, not just for protection. It has become an index of one's fashion ideology of wearing different types of masks and other things. So how did this change over a year? In way back in March 2019, so March 2020, we never thought that these things would occur. Suddenly on March 24th, and suddenly everything changed. And today, Corona or COVID-19 virus is not only infecting the persons, but also has caused an havoc in one's own mind. Everywhere, every aspect of life, whether it may be general your routine activities, or your work, or economy, or health, whatever, technology, everything has changed because of this so small, tiny virus. And today we are seeing all the mishaps which this virus has caused to the entire world. So and we are being bombarded with the knowledge. I don't know how many of you really do that, but there is a new university called as WhatsApp University. And this WhatsApp University has given so much of, I don't know whether we to call it as knowledge, but some information, and it has become information overload, and we are in the era of virtual fatigue. And all this was because not only this COVID has infected one's lungs and caused difficulty in breathing, but also it has made life so miserable to most of the people. And that too for a technology background like you people, most of you must be suffering from virtual fatigue. That is what we are seeing the patients, that is post-COVID era. I don't know, we cannot even call it as post-COVID era because there is a re-emergence of a new strain that is also being evident now. So, in response to this COVID-19, what we need to understand and do the containment measure is to understand where we are today, knowing the current scenario, information what needs to be given, what about the stigma and discrimination, how about the personal safety and support and public health services that needs to be adopted. So global pandemics declared by WHO started from 1700s with smallpox. Of course, we managed to eradicate smallpox till date. That is the only disease being eradicated from the world. That is, there are no evidence of that disease now. Then comes the measles, influenza, yellow fever, plague, malaria, cholera, bubonic plague. Not only that, in the beginning of the previous century, we had a Spanish flu, and they kept on telling that every 100 years there will be such kind of pandemic. And we are seeing that exactly 100 years after the Spanish flu, we are seeing the COVID-19. Of course, those started in 2019, but the major proportion of the damage, whatever it was supposed to cause, it was done in 2020. Of course, HIV, SARS, which came up in 2002. SARS had a higher mortality, that is deaths due to that virus. And the present COVID virus is an adaptation or a modification, mutated version of serious, that is SARS respiratory distress syndrome virus. So this SARS causes severe respiratory distress. That is why it is named as SARS. Then came the Ebola, and then presently we are having COVID-19. We also had something called as Nipah virus, MERS virus, that is Middle East Respiratory Syndrome virus, because basically all of them, they target the lungs. That is how these viruses do function, and they are different variants of the influenza virus. Why this is a unique viral syndrome, not unlike many other. Earlier when it had come, we thought that it would behave like SARS, it would behave like some other influenza, it would behave like Nipah, but unfortunately it did not. The COVID-19 was declared pandemic on 11th March 2020, and the Director General of World Health Organization. Why it is so unique is because it frequently changing new strains, as we are evident now. Recently, just a week back, we have seen a new strain of virus. We don't know yet how it is going to behave in future. The infects both upper and lower respiratory system, and even the gastrointestinal system is a uniqueness of this virus. Most of the influenza virus, they infect more of the respiratory system, but this particular virus is not only, most of the people, at least half of the people, they are having gastrointestinal system, like acute gastroenteritis, like diarrhea, dysentery kind of thing. It is highly contagious. You never know how quickly you may get contracted with the infection of this virus, with an exposure to what is the level of exposure, that is again a matter of for debate there, and causes severe immune response. See, again, if it had just infested the respiratory system, that would be somewhat controllable, but here what it does is it causes severe immune response, and that immune response is the major reason why we are seeing so many deaths related to COVID. And the most important one being, the outcome is unpredictable. We never know which patient is going to respond in which manner. There we have seen that a patient who comes with a very subtle infection and coming with not many comorbidities, but because of that fear and this rapid immune response, people have succumbed. And elderly people, though without having any comorbidities, within a matter of 5 to 6 days, they have died because of this virus. Of course, the number of deaths are significantly less, but still the outcome is unpredictable, is most important one. And the most important one, again, apart from this, is the post-infection sequelae. The sequelae, generally, what happens once the infection comes down, you do an RT-PCR test, it comes negative. Okay, fine, at least you have got antibodies, you are done with the infection, you can go home. Is it enough? No, because there are chances. The one is post-infection sequelae. What are the complications? And the worst complications which we are seeing here is the thrombotic complication, that is the clotting of the blood in the blood vessels. And because of this, we are seeing so many complications, post-COVID complications, up till 3 months, 6 months, depending on the morbidity condition or the disease status of the individual and the extent of the lung involvement. And the serious one being the lung fibrosis, where the patient will have serious difficulty in breathing for a long time. And chances of reinfection, unlike all other viral infections, once the person gets infected with viral infection, generally the chances of getting a reinfection is very, very less. Unlike here, there are some cases which have been reporting the chances of reinfection, which has to be taken into account, and not just forget about the virus being existent and not taking appropriate preventive measures. So current status updated as on today morning. So we have around 7,90,57,000 odd cases reported in the world till date, and total population keeps on changing, and among them 27% of them are being active, 70% are recovered from these cases. So still we have 27%. Unlike when I was giving a lecture a month ago, this percentage of active cases were just 20% or even 19 to 80%. In a 1 month, the percentage of active cases are increasing, means there is a second wave that we have to be very cautious about. And 70% of them have recovered. That is a very good sign. And disease, how many of them have died? Throughout the world, there are 2% deaths. Unlike for SARS, which came in 2002, the mortality rate, the case fatality rate was up to 10%, but here it is 2.2%. Among the active cases of somewhere around 2 crore 16 lakh 70,000 cases, around 1 lakh cases are in serious conditions. 1 lakh 6,000 cases and odd are serious condition. We never know the outcome is unpredictable. This was in the world, but coming to the Indian scenario, updated just in the morning, we on 19th of this month, 19 December 2020, we crossed 1 crore mark of the number of cases of COVID in India. And among them, only 2.8% are active. You can just imagine, if you compare throughout the world, the percentage of active cases across the world is 27%, whereas active cases in India is just 2.8%. It is a point to be noted. And because in the wide population, you can just see the total number of total population above there. It is 138 crores plus counting, and 138 crores, among them 1 crore being infected, and active cases is 2.8%. Of course, this 1 crore cases that is being reported through the government agencies and various other surveillance which we have established. There are so many unreported cases who have directly gone, did a HRCT X-ray and got treated at home isolation and so many other things, because 70% of the healthcare in India is provided by the private sector, and we do not have an account of really what is existent. But when we look into zero prevalence, which has been undertaken by ICMR and Government of India, they say it is at least 20%. If they are telling it is 20%, it is just a randomly picked sample, and definitely the number of cases are much higher than what these numbers are. So, and even the active cases also is a big question. Of course, these are the ones we get through whatever the surveillance and the report being generated by the government agencies. We have a very positive hope. Unlike in the world, 70% of recovery cases, in India it is 95% recovery case. And deceased, you can see how many people have died. It is 1.4% who have died. And currently among the active cases, around 3% cases are serious. So COVID-19, as we know, what are the symptoms? Of all of you are aware. If you are not aware, if you just dial your phone, every day you are hearing this message of what are the signs and symptoms of COVID and what needs to be done. Fever, cough, and difficulty in breathing. Among them, fever and difficulty in breathing are the most common thing, most important ones when we see. But we never neglect the weakness, muscle aches, and diarrhea. If you have these and you are in contact of a lab confirmed positive case, immediately you should be reporting to the health center. Unlike people used to get scared if at all we go, and there will be a lot of other measures taken by government agencies. They come and do quarantine, they'll send us to the hotel, they'll send us to the hospital. No, it is not that. Those days are gone. Those days were there when we did all these activities firsthand. When the first case of in Belgaum, the first case came, we were the one we led in the forefront along with the taluka health officials and other things. So we went and did the quarantine, did the lab sample test of 72 contacts, primary contacts of those cases. And later on, there were so many here and there. Then it went to the major hotspot was Hirebagrewadi in Belagavi district. And subsequently it went on, and whole district, not only whole district, whole country, there is no district which is not, we cannot say that there is no reports of COVID cases. That is the extensivity of these cases. And of course, it was new then. So we were not prepared. The health system was not prepared. Of course, that is why lockdown was imposed. And lockdown was not because to stop or do something unwanted things for people of India, but it was a time where the government took that time so that to upgrade the health system, so that we became capable of managing this situation. That was the thing which we did because of this lockdown. Of course, it helped in many other ways as well. So prevention and safe practices, one is hand hygiene, respiratory hygiene, social distancing, and high risk groups. These are the 4 things that we need to understand at this juncture by all of us, irrespective whether you're a law student or a technology student, you're a medical student, whoever you may be, basically you're a human being. And we are all staying in this earth, and hopefully we continue to stay for some more time, some more years. And if we want to do that, better to have the safe practices of hand hygiene, respiratory hygiene, social distancing, and high risk group. We as medical professionals, we kept on advising people regarding the hand hygiene. On September 16th of every year, we used to every year celebrate World Global Hand Washing Day. And we used to demonstrate the techniques of hand washing to all the students, the children, the general public, everyone. People never used to listen. Okay, they used to listen. Okay, hand washing karna hai. Okay, we'll do that. Karke they used to just keep quiet. But today, COVID has definitely made our job easy, and people have learned to use soap and water for hand sanitation. Earlier, even the tuberculosis patient, they never used to cover their face whenever they used to cough or sneeze. It used to be so annoying and so difficult for medical professionals, especially healthcare professionals, including the staff nurse who are the frontline workers, to get exposed to those serious bacterial or viral infections. We were exposed to all of them. Sometimes many of us have suffered because of these unhygienic practices of the general public. But in spite of all those things, today we need not tell that. And you might see, if you just see the incidence of respiratory illness over a period of 1 year, you can see a drastic reduction in sinusitis, drastic reduction in allergic rhinitis, drastic reduction in all the respiratory symptoms, including that of pneumonia, and all because thanks to COVID virus for bringing that concept of mask in our people. Social distancing is we cannot say 100% it is possible, but many a times when we go outside, when we are sitting in a medical college, sitting in the hospital, we talk all big things about social distancing. But once you go outside your campus and just look into, social distancing has become a joke, and that is the serious problem that we are facing. And of course, taking care of the high risk groups needs to be done. So the modes of transmission, all of you are aware of it: sneezing, coughing by the infested person, infected droplets, that is which contain virus, get infected droplets on your hand, and when you touch surface or person, earlier we used to shake hand. If we don't shake hand, we used to think that the person is very arrogant. And today, if anybody is shaking hand, we'll be very much worried, because we are worried because he might have transferred us a virus. And sneezing, cough by infected person, you can see the infected droplets can be anywhere, practically anywhere on the bars. Whenever you are climbing down the stairs, many people have the habit of keeping your hand on the bar and slowly dragging away. But even there might be the chances of droplets. This is I'm not only talking about COVID, but all the infection. I generally keep on telling my patients, also my students, that just because COVID-19 has come doesn't mean that all the other viruses and bacteria have taken holiday and they have gone for a foreign trip. No, it has not happened. Still, as much as COVID is there, tuberculosis is also there, leprosy is also there, influenza is also there, HIV is there, so many other diseases. Everything, they are already there and they continue to be there. And by preventing COVID, you should also be aiming at preventing other diseases, which are infectious in origin, and virus get transferred. So hand hygiene, what needs to be done? So wash your hands often with soap and water. Most of the times, this hand hygiene is a way of cleaning one's hand and substantially reduces the potential pathogens, harmful germs. And generally, hand washing with soap and water is the best for at least 20 to 30 seconds. Or use at least the sanitizer where 70% of alcohol is there, because that also kills the virus. So, especially when you come back from public place or after blowing your nose or coughing or sneezing, use a hand sanitizer, and soap and water, if not available, cover all your surfaces. And please don't touch your eyes, nose or mouth with unwashed hands unnecessarily. That is what, because all these, we keep on touching different surfaces like door, knobs. Generally, we keep the hand on this table. Everything is a problem. Elevator buttons, handrails, support handles, chair backs, ATM surfaces, mobiles, jeeps, handles, everything can be a potential source of infection.